Good afternoon, everyone. Welcome to the 2020 National Freedom of Information Coalition FOI Summit. Many thanks to all of you for joining us today. This is the 31st annual FOI Summit. The NFOIC has been doing this for over 3 decades now. So again, many thanks for all of your support and your participation each year at these summits. We have a great presentation waiting for you today. My name is Justin Silverman. I'm the Executive Director of the New England First Amendment Coalition. We're the region's leading advocate for First Amendment and the public's right to know. You can find out more information about our work at nefac.org. That's nefac.org. I'm going to provide some brief introductions to our guest speakers today, but I do want to say, please take all of the information that you receive during this presentation, share it on your social media platform of choice, make sure that you include the hashtag FOI Summit, and make sure everyone knows about all of the great information that's being shared today during this presentation and throughout all the other sessions. As I mentioned, we have a great panel. We have 3 guest speakers, all of whom bring a tremendous amount of expertise and knowledge and advice to the table to really help us get a better understanding of where we are today when it comes to getting access to public health data, access to government information, particularly during the COVID-19 pandemic. We're going to begin with some presentations, and then we'll pause at around 1/4 to answer any questions that you might have. But first, some brief introductions. We're joined today by Amanda French, who is with the COVID Tracking Project, and you can follow their work at covidtracking.com, as well as follow them on Twitter at COVID-19 Tracking. Amanda is going to give us a good sense as to where we've come since March when this pandemic began, where we are now as far as restrictions on the public's right to know, and in particular, what type of information is still especially difficult for all of us in the public to obtain. Also joining us is Ganita Singh, who's a legal fellow at the Reporters Committee for Freedom of the Press. Ganita is going to offer us some very practical, helpful suggestions on how we can overcome those obstacles, give us some ideas that we can put to work after this presentation to make sure that whether we're a reporter working in a newsroom or a community advocate or just a concerned citizen, that we can get the information that we need, overcome any kind of FOI obstacles, and make sure that we're all informed about these public health issues. And last but not least is Alameen Sumar, who is counsel for the New York Times. Alameen is going to provide us some education on all of the legal underpinnings to this conversation. What are the federal statutes or state laws that are at play here? How are they helping us get access to government information, or how are they working against us and the public's right to know? So many thanks to all of you for joining us and taking your time, volunteering to be here today. And again, thank you to everyone who is in attendance for this presentation. I'd like to start with Amanda. As I mentioned, Amanda, as part of the COVID Tracking Project, has a very good perspective on just where we have come over the last several months when it pertains to public health data. Amanda, if you could you catch us up to speed? Tell us, what's been going on over the last several months since the pandemic began, and then tell us where we are currently as far as restrictions on the public right to know and what information we may still be having difficulty accessing.
You bet. Would you like me to share my screen, give a presentation, or just chat? Either one I can do.
Presentation would be great. You should have your share screen option on already.
You bet. I can absolutely do that.
Great.
So I'll try to be quick, and please do interrupt me at any point if you have questions. I have prepared a talk, but I certainly am happy to stop that at any moment and answer questions. So yes, let me just show you some things about where we have come so far. So first, just a little bit of introduction about the COVID Tracking Project, which is the organization I'm with. Some of you may be familiar with it. You can find us at covidtracking.com. Our official title is, in fact, the COVID Tracking Project at The Atlantic. So we are affiliated with The Atlantic magazine, but we are not really organizationally part of them. We are primarily a volunteer effort. And we began in early March to fill a gap that was caused by the CDC not reporting COVID data about cases and testing in particular, about the degree of testing that was being done nationally. End of February, the CDC made an announcement that if you wanted to know how many tests were being done, you should go to your state website. If you wanted to know how many cases, you should go to your state website. And a lot of this was due to just sort of systemic, in multiple senses, difficulties with providing the data that a lot of people wanted to know, especially about testing data. So Alexis Madrigal at The Atlantic and Robinson Meyer, also of The Atlantic, said, okay, if we're supposed to go to state websites, state public health officials' websites to find data about the pandemic, that's what we'll do. And we'll go to all of them and put the data into a spreadsheet and share it. So that effort has garnered now many, many volunteers and has been going on since early March. The CDC for 10 weeks did not report COVID data. They did relaunch a data tracker around May 10th, May 12th, 15th, depending on how you go. So there is now some national data, but we've continued collecting data from state public health officials because it is fascinating to see, really, for many reasons, the differences in what the states are reporting versus what the CDC is reporting. And you asked about, what we've seen happen over the course, since March. What we've seen is that the states are reporting more and more data. What they are not doing is reporting that data in a standard fashion. So if I had one takeaway, it would be, I think Dan had asked us to sort of give calls to action for the people watching these panels. It would be to contact your jurisdictional officials, especially your state officials, and ask for sort of more standard and consistent data. And I can show you a little bit about what I mean in terms of that. So here's some of the data that we collect. We collect case data, meaning how many people have tested positive for COVID-19 or who have been diagnosed with probably having COVID because of contacts they've had with people who've been exposed or other sort of epidemiological evidence that I won't go into. How many tests have been done nationally or state? Hospitalizations, who is hospitalized, who's in the ICU, who's on a ventilator, and outcomes, who's recovered, and who has died, unfortunately. Now, because we collect data from states, there are a lot of interesting differences and sometimes very, very significant differences in the data that we collect versus what people who collect data from counties, like the New York Times, find. Because a lot of times in just sort of transferring data from the counties to the states, you'll get differences, which are usually due to just sort of normalization of that data. One of the big things that we just wrote about quite recently is you may notice that we are currently reporting under 200,000 deaths in the United States, whereas both the CDC and the New York Times and other data trackers are reporting that we have surpassed 200,000 deaths. And even those counts, we know for sure, are probably an undercount of the number of deaths that have taken place in the United States. One huge reason that our deaths are so much lower than other trackers is that New York City and New York State have extremely different standards for what counts as a death from COVID-19. So New York City does count what we call probable deaths, meaning that this person probably died from COVID, even though they never had a positive test result confirming that they did indeed have COVID. Now, this is not just a sort of an educated guess. These probable cases, there are very strict definitions about what constitutes a probable case. Usually it's a different kind of test, a less sensitive test than the PCR test, and known contact with people who were confirmed to have COVID. So there are, last I checked, something like 4,600 deaths that New York City classifies as COVID deaths that New York State does not recognize as COVID deaths. So because we are reporting state data, those nearly 5,000 deaths are not reported, and that's New York City only. So a lot of those others are from that same anomaly multiplied by other cities and towns and states. The CDC solves this problem by counting New York City as its own state, which some people would argue might be a good thing to do.
And Amanda, if I
Yeah.
could ask, maybe you could speak a little bit more to the specific types of information. You have a tremendous amount of data here, but are there any specific categories of information that you've seen from state to state where access just varies greatly? You know, from where I am in Massachusetts, for example, I know the state was, they were long overdue in providing any kind of information on the demographics of those who had COVID, or you know, information on clusters, either in prisons or long care facilities. You know, where do you see the big inconsistencies from state to state?
Yeah. So race data and ethnicity data is a big one. We have launched a race and ethnicity data tracker. The very last state to provide any race and ethnicity data about who was contracting COVID or in fact getting tested for COVID was North Dakota. And in fact, North Dakota still does not report death data for who has died from COVID. And the reasons for this, they say, are privacy laws. Privacy concerns, so that the number of people who are of color in North Dakota who have COVID is sort of large enough to be reported without breaching any privacy concerns, but the number of people who died is small enough to where they would be concerned about that. So there's been a great deal of difference with that. And again, actually, to speak to your original question, over the course of the pandemic, we've seen more and more states begin to report race and ethnicity data. I know Maine was a holdout early on for kind of similar reasons. What we've, again, one of the things that we've seen just so much of, which is really just not necessarily visible to everybody, is just how differently certain data points are defined. So if you say, such and such a state is reporting the number of tests, that means a very different thing from state to state. So for instance, some states are reporting the number of specimens tested at the laboratory, while another state is reporting the number of unique people tested. And another state is reporting in something like test encounters, which is which is not unique people, like the number of individuals who've been tested, but does it includes people who've been tested multiple times. Hospitalization data is another one. For a long time, Florida was very delayed in reporting hospitalization data, current hospitalization data. And we in fact found that that was one of the best ways to track how bad an outbreak is. How many people are currently hospitalized? And Florida didn't report that data for a long time, although they are now. So different categories of data, states report, just all over the place in terms of what kind of data they report and just how they define that data point. I could talk a little bit more about what we call, congregate living facilities, including prisons, and especially long-term care data, because we have an amazing data set on COVID in long-term care facilities, which includes nursing homes, assisted living facilities, and similar organizations often funded by CMS at the federal level. And COVID is extremely bad in those facilities. And one of the really interesting things that I've seen, for instance, in my home state of North Carolina, is that while North Carolina changed how it was reporting data about nursing homes and similar facilities in June. Originally, they were reporting case data and death data for both nursing home residents and nursing home staff. The number of nursing home residents who died from COVID was much, 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 much higher than the number of nursing home staff who died from COVID. That data stopped in June because the state of North Carolina began reporting resident and staff deaths and cases lumped together so that you could no longer tell the difference between who was a resident and who was a staff member at a nursing home. So things like that. And that's just, again, you multiply that by, a dozen data points across 56 states and territories. And that lack of standardization is just something that we see everywhere. And states can just change. They can just change what North Carolina, in the way that North Carolina did. They can change their definitions. They can change whether they report something, whether they don't report something, and they do.
Mm-hmm. Yeah, so clearly there's an issue there with the lack of consistency, with policies, and even consistency within the definitions of how things are reported. But if I could go back to a comment that you made a few moments ago, talking about privacy considerations, because I think anytime we're talking about health data, we're just naturally going to have on the other side of the debate privacy arguments and reasons that we shouldn't have access to that data out of concern for individual privacy interests. Have you encountered any federal laws, for example, or even any examples of state laws that have really made it difficult to get information relative to lawn care facilities or any other type of outbreak, cluster outbreak, for example?
Well, I'm not myself a lawyer, and honestly, the legal landscape is something that I'm really interested to hear from Al-Amin about, because it's in a way, so many of the obstacles that we encounter are technological and sort of logistical and definitional rather than legal. So I'm not sure that I can speak to that. What I can say is the issue that comes to mind a lot for me is institutions of higher education, actually, and K through 12 education. So with the beginning of the school year, we started seeing a lot of colleges in particular spin up their own data reporting dashboards. And occasionally we'll even get messages from the public saying something like, I think my school is misreporting the data. Do I have any recourse? And the answer is no, because especially for private colleges and universities, that college and university is really not accountable to anyone for the way it's reporting that data. It's just sort of doing so as a community service. So, school districts have begun to report some COVID data, for K through 12 education. And FERPA is absolutely a concern. And similarly, when there are small numbers of either cases, we wish they were smaller, in fact, in certain places like Wisconsin, we've seen college towns just, seeing tremendous outbreaks with the start of the school year. So colleges and school districts are doing a lot of reporting. It's not clear to me whether any of that is mandated at all by state law or federal law. My sense is that it is not, but I would love to hear from others about whether that is.
Yeah, let's transition to FERPA. Al-Amin, could you provide us some perspective on what federal laws might be providing some roadblocks here between us and information? I know, personally, I'm always hearing about obstacles that journalists are encountering, in particular, trying to get information, being told, no, we can't give you this data. HIPAA, always being used or misused, I should say, many times. Between HIPAA, FERPA, or any other laws you can think of, maybe you can just give us a good look at the legal landscape that exists here when we're talking about public health data.
I will certainly try. But thank you for the introduction, and thanks to the folks organizing the summit for having me. It's an honor to be here. My internet should hold up. I told my girlfriend not to watch Top Chef for the next hour, which made her very upset, but she's agreed to do that. I actually started learning about this at the beginning of the pandemic, and this was before I came to the Times, when I was starting to see HIPAA especially come up as an excuse that states and localities were providing for not giving over basic coronavirus information. And there were a couple things that were really striking about that. One was kind of the basic information that wasn't being provided. Not, it wasn't like news organizations were asking for street addresses and phone numbers for patients, but just how many cases do you have in this county? And or in this city, in this municipality, and they weren't getting that information, and in some cases still aren't getting that information. And the other thing that was striking was just the kind of discrepancies within a state. So you could have one county taking one view of HIPAA and state laws and providing certain kinds of information, and then you would have a county next door saying, actually, we read this very differently, and we're going to give you other information. And so, I think with this, as with a lot of other issues, journalists were coming to me and saying, these people are in bad faith withholding this information. They know that this is not in compliance with the law. And that, I think, is true in some cases, but I think In other cases, they just don't understand what HIPAA requires them to do. And so I was really interested in sort of getting a better understanding of laws like HIPAA and FERPA so that we could also help FOIA officers kind of understand exactly what they were allowed under the law to give us. And to take HIPAA first, you know, when we talk about HIPAA, we associate that with sort of these rules around privacy. And those are a part of HIPAA, but HIPAA was actually, you know, the statute enacted in 1996. It covers a lot of different things, not just privacy. But what happens is in 2000, the Department of Human Health Services promulgates a set of privacy regulations. They're now known as the Privacy Rule. And it's what we associate HIPAA with today. And these are really the regulations that are at issue when we're talking about trying to get information about coronavirus from state and local governments. And the essence of the rule, the privacy rule, is actually very simple. You know, it's not written in a simple way, but it actually is very simple. It's just a set of regulations that limits whether and how certain entities can use and disclose individual health information without the individual's consent. And those entities are defined in the regulations. There are basically two kinds. There are what we call covered entities, which are basically health plans, healthcare providers, and certain other kinds of protected health information, or what we call associates, which are basic. Sorry.
You froze up a bit. If you wouldn't mind just backing up about 15 seconds or so.
Okay, sorry, appreciate that. So there are basically, you know, two kinds of entities that are subject to the privacy rule. There are covered entities and there are business associates. And healthcare providers, certain other kinds of entities that translate PHI or protected health information from one format to another. And then there are entities that we call business associates, which basically just help covered entities do their jobs. So that's one important aspect of the privacy rule, is the kinds of entities who it regulates. And then there's also protected health information, PHI, the category of information that's covered by the privacy rule. And this is actually defined really broadly to include any information that relates to an individual's health and that identifies or could even reasonably be used to identify that person. And on this point, the privacy rule is very clear on what sort of entities need to do before they can disclose health information that pertains to people. There's basically one of two things they can do. One is to get sort of an expert opinion from a statistician who says it's very unlikely that, you know, if we disclose this data, a person could be identified, which is possible, but I've never actually heard of that happening. The much more common route is what's called the safe harbor method, which requires the entity to remove 18 specific identifiers from the information that it wants to disclose. And that includes information like county and zip codes in some cases. And so that is why some counties and localities are under the impression that, you know, they can't provide more than, for example, county level data. And, you know, the most important exception to talk about here, I mean, we're going to get into sort of other strategies for pushing back. Gunita will talk about that, and I could talk about that later. But the most important exception, or the provision that people need to be aware of when we're talking about access to public records, is what we call the required by law exception. So there is a provision in the privacy rule that says a covered entity may use or disclose PHI to the extent that it's required by law. And, you know, in the preamble to the privacy rule, the folks who drafted the rule made very clear that the idea was to preserve access to information whose disclosure is required by, you know, federal and state law, and they talk about federal FOIA specifically. And all the courts that have, you know, there's actually a body of case law that predates the pandemic, where courts have looked at this and said, of course, this applies to our state public records laws. So if a record is subject to disclosure under our state public records law, then disclosure is required by law, and HIPAA doesn't independently apply. So when you're talking about a public records request, unless the state or locality can show that it's independently exempt under some state law provision, HIPAA has no effect at all.
So if we could pause right there, Albie, because I think this is a really important point and something that's often lost in our conversations about HIPAA. What you're saying, if I understand you correctly, to put it in short, if you have a state public records law that requires the disclosure of certain information, it doesn't matter what HIPAA says. That public records law needs to be followed, and that information needs to be disclosed. Is that right?
That's exactly right. So, you still have to deal with the state law exemptions. You still have to deal with personal privacy, which is in some way or another a part of basically every public records law. You have to deal with the states that have more, restrictive provisions for certain kinds of information. So for example, in Arizona, there is a statute that bars disclosure of communicable disease related information. And on the basis of that law, a court denied a request by media entities to get more information from the state about coronavirus in nursing homes. But unless you have statutory provisions like that, you're just dealing with personal privacy exemptions. And obviously those don't apply when you're talking about information that doesn't identify anybody. And even if it could identify somebody, usually the test is there a public interest in disclosing this information, and does it outweigh the privacy interest? And that is the analysis that should be applied, not HIPAA, because HIPAA, again, doesn't have any sort of independent effect. There are more things to say about HIPAA. Gunita will probably get into it, and I can come back to it. But I do want to talk about FERPA too, because that has become sort of an important roadblock too. It hadn't been something I dealt with until I came to the Times, because our reporters are using public records laws wherever they can to get information about cases and testing. And they're going to a lot of public universities all over the country. As Amanda says, some of these schools do disclose information, some of them don't, and sometimes there are discrepancies. So, what you need to know about FERPA, it's this law that gets enacted in 1974. It's been amended a lot of times since then. And the basic idea is we want to make sure that parents can get and sort of students of adult age can get access to their student records, and that information doesn't get disclosed to anybody else without their consent. And so FERPA provides that those records are to be kept confidential unless there is consent. And it's a piece of spending clause legislation. It says that if you're receiving federal education funds, then you have to have a policy. You cannot have a policy or practice of permitting the release of educational records. And where it gets difficult is sort of in the definition of educational records. So the statute says that there are basically two elements to what is an educational record. The first is, does the information directly relate to a student? And the second is, are the records maintained by an educational agency or an institution? The second one is usually clear. The first is not, and there has been sort of a lot of litigation about what does it mean for something to directly relate to a student. Some courts seem to think that if the records even mention a student, they're subject to FERPA. That doesn't seem like a good reading of the law. The students should at least have to be kind of the focus of the records. But you may have a sort of uphill battle to climb in showing that a record that mentions a student by name is not an educational record. So we should let's go to Gunita, because as you mentioned, we do oftentimes have this uphill battle to climb. And just as an aside, should just note to everyone who's watching, Al-Amin, you'll be having a presentation later today on HIPAA specifically. So if anyone has any additional questions, please do attend that session. But Gunita, this uphill battle, we have a number of laws that are being either interpreted differently or misinterpreted. You heard from Amanda
other, just logistical challenges in trying to get the data that we need to understand this pandemic and how our government's responding. What can we do? Are we helpless in this battle, or are there specific things that we can all do in our different roles to make sure that we get this information despite these challenges?
That's a great question, Justin. That is the question of the hour. I would be happy to give a few sets of tips for, I think, each stage of the process of requesting records. And these are sort of best practices that stem from working directly with journalists and seeing their experiences, my own public records work, and things I've learned from my colleagues at the Reporters Committee. So I think I'll take a step back and kind of start at the drafting stage first. So the more thought and care that you put into your initial drafting process is going to save you some headaches later down the road. So you should be looking at whether other people or organizations have obtained these records you're seeking, or maybe there are other avenues to requesting the records to potentially speed things up. If you do choose to file a records request, definitely try to be as precise as possible and asking precisely for what you want, because that's going to help the records custodian get you the records more easily, and then you'll be able to get the information you want more quickly. Hopefully, that's the goal at least. If an agency denies your request, so many times the records management staff simply misunderstand their obligations under public records laws. So it's always worth it to administratively appeal adverse determinations. And if you are requesting records from a state whose law doesn't have an appeal mechanism, or maybe doesn't have an ombuds office for you to work with, keep following up with the agency through email, through phone calls, build that rapport, establish that relationship, be as persuasive and compassionate as possible, because a lot of times that human element is just going to help you to get the records and the information that you want. To come back to HIPAA, if the agency does cite HIPAA as the means to deny your request, be vigilant. It's extraordinary. And Alameen and Amanda know this. It's extraordinary how many times agencies will misapply or over-apply laws like HIPAA to deny information that actually isn't protected. So just to reiterate, because I do think this is an essential point, as Alameen explained, HIPAA only applies to covered entities and their business associates. So most of the time that's going to be hospitals, clinical laboratories, health insurance plans. Of note, not all state health departments, public health, or communicable disease divisions are even covered by HIPAA. Sometimes they're hybrid entities and some parts of the agency will be covered by HIPAA and some won't. And that kind of goes back to what I said earlier about doing all the research you can at the front end to kind of save you some headache as you progress further down the public records process. Most importantly, because HIPAA's privacy rule doesn't apply to de-identified or aggregate data, which is 9 out of 10 times what reporters are seeking when they're trying to understand the scope of the virus's toll. So definitely consult the Journalist Guide to HIPAA available on the Reporters Committee website. And I'll try to drop a link to that in the chat because folks have said it's been super helpful in pushing back when the state seeks to deny access to this sort of information. For example, it explains that provision that Alameen referenced earlier, that HIPAA doesn't bar disclosure of records that are otherwise required to be released under a state public records law. So our guide, it cites to that provision in the Code of Federal Regulations. So you'll be able to copy and paste that and cite it in your correspondence with the agency. Our guide includes Health and Human Services guidance that further explains that provision. It provides examples of that provision in action. For example, in 2006, the Ohio Supreme Court held that HIPAA couldn't bar disclosure of records about lead contamination, where disclosure was actually required by the Ohio Public Records Act. So definitely rely on the information in the guides available on our website. If you're wondering how to figure out the contours of your state's public records law in order to evaluate its interaction with HIPAA, we have a 50-state open government guide available on our website, which will be able to help you with that. But finally, sometimes you're just stuck, right? Sometimes the law just isn't on your side. Sometimes the agency you're dealing with is just being stubborn and you've hit a big wall. So what can you do? I really encourage you as a journalist to just get as creative as possible when you're thinking about what realms outside of the public records context can you use. So I'd reemphasize the COVID tracking project, right? Which Amanda discussed. It tracks how many tests have been administered. It includes that state-by-state count of positive and negative results. Among other information, it's updated daily, so that's going to be a great resource. Of course, the Times has done a remarkable job tracking down data, not only by filing records requests, but by attending press conferences and obtaining data from non-government entities as well. But if you do want to keep working with the agency directly, and you're trying to get records from them, but you've run into challenges not necessarily related to HIPAA, but maybe the problem is delays resulting from the pandemic itself, right? There are definitely strategies you can employ to encourage compliance from agencies that might be using the pandemic itself as a means to close shop, right, and forgo their public records obligations. So what I'm going to point to, and I'm going to share my screen in just a moment, but I'll mention the Reporters Committee has compiled and regularly updates a chart on our website that has up-to-date information on the status of open government laws across the country for you to consult as you navigate the situation. And it's been a really helpful resource for folks, not only because it explains what kind of modifications have been enacted in order to suspend agencies' duties to comply with freedom of information laws right now. And it's, of course, really helpful to be aware of those modifications and suspensions. But alongside all of that information about the modifications and the delays, there are also good examples in this chart that I'm about to share of government entities that are continuing to value the public's right to know right now. So I highly suggest if you're dealing with a stubborn or non-responsive agency, you can go ahead and consult our chart to say, hey, there are plenty of agencies that are prioritizing the public's right to know right now. It's very much possible to balance working remotely, different hours and public employees might be working with prioritizing the public's right to know. And we've heard from journalists that it's been a really helpful resource. So I am just going to briefly share my screen to give you a sense of what this looks like. And you can get a taste for yourself. So this is the chart, and it has all kinds of jurisdictions ranging from the agency level to municipalities to what modifications have been enacted through state legislatures. And of course, most of these, I would venture and say maybe 75% of these are information about delays that have been reported from folks who've got in touch with us and said, hey, the agency told me that they have no idea when they're going to respond to my request for public records. Some of these are about promulgations from governor's offices saying, hey, agencies don't have to respond to requests right now. But if we Google, for example, the Minnesota Department of Administration, we'll see that they're actually encouraging their public records staff to consider waiving copy fees right now, right? To give folks who are requesting public records a break during this extraordinary time. If we look at the Attorney General's office in New Mexico, we see that they're saying all deadlines with the New Mexico Public Records Act should still be satisfied. And if an agency is totally swamped right now, they need to communicate that to the requester immediately. So there are some helpful provisions in here that you can cite to. And let me, okay, stop share. Okay, I'm back. That's been helpful because as we've heard from folks, there's sort of this dance between shaming the agency or encouraging the agency into compliance, and it's often worked. And the last thing I'll definitely say is feel free to get in touch with Reporters Committee attorneys through our hotline, which is available 7 days a week for y'all to get in touch with Reporters Committee attorneys for all of your news gathering and public records questions. So those are all of my best practices and tips that I have off the top of my head, but by all means, if there are more targeted questions within the next 10 minutes or so, I'm happy to try my best to answer those.
Thank you. And I should also note that these are tremendous resources, but they're helpful not just to reporters, but to all citizens and everyone
Yes.
within their communities looking for information. Thank you for that, and in particular, the additional information about HIPAA. We're going to get to questions in just a moment, but I do want to go back to Alameen just for a minute or two. If you could give us some suggestions on how we can address any kind of information denials based on FERPA. We know now that we have some resources at our disposal regarding HIPAA, better understanding of what covered entities are at play. But with FERPA, we get the denial citing FERPA. What do we do? What suggestions do you have for us?
Yeah, the arguments are actually kind of similar to those you could use to push back on HIPAA. So one important thing to know is that FERPA just doesn't apply to records that have removed personally identifiable information from them. And the regulations make very clear what PII is in this context, you know, the name of the student, their address, other information that could be used to identify them. So in cases where you're looking for aggregate data, you know, FERPA shouldn't be a problem. And FERPA also has a kind of emergency exception, which also exists under HIPAA, and you can read about in the Reporters Committee Guide. But basically, if it's necessary to protect the health or safety of the student or the persons, the school can disclose the information without consent. And that's always something that's important to point to, because, you know, people are attending these institutions, they don't know what kind of risks they're walking into. That is a real credible threat to health or safety. So those are the only things I would add.
Thank you. And do you want to get to some questions? We have another session coming up at 3 o'clock, so we have a hard stop in about 12, 13 minutes. First question, and I want to pose this to you, Amanda, if we could go back to you and your experience collecting all of this data and trying to work around these legal obstacles. Question comes from Chris, who wants to know, well, you know, what if we're not dealing with any kind of legal hurdles here, but instead what's preventing us from getting the information we need is, you know, an outdated website or a bad computer connection? Can you speak to those tech issues and provide any suggestions, if you have them, about what we can do to overcome them when we experience them?
Absolutely. I saw that question come in, and that is right in my wheelhouse, as I say, because, you know, from my perspective, states are providing a great deal of data that we are, public health offices, that we are collecting. And I think are not always required to by law. So to speak to that question that was specifically about Texas's outdated technical infrastructure, that is something that is not unique to Texas. It's something that Texas has struggled with a great deal. They have on numerous occasions done big data dumps of huge backlogs of data that they've gotten from, you know, often commercial labs, that kind of things. They had a big interruption in reporting because of the hurricane, which was completely understandable. And to cut to the chase, I think that the answer is twofold: investment in this kind of technical infrastructure. That is always worth advocating for in your county, in your state, and in your country. But also, I think, this is where I get really nerdy, I think actually procurement laws are an perhaps underappreciated player in this. The article that the questioner shared that was specifically about those issues with Texas was talking about, oh, and they actually did hire a contractor to build something really quickly, and then still nobody liked that system. And the system that they were using was outdated and so on. It's almost standard practice for, you know, at the state and federal level for software companies to take millions of dollars to build software that doesn't work and nobody likes. Sometimes they just abandon the software. And I think that, you know, it's really almost a hobby horse of mine that reforming the way in which state and federal contracts are awarded would make things better in so many areas of our life. We actually saw this with unemployment systems as well. In places like New Jersey, it made the news, you know, how outdated those systems were and broken by the massive number of people applying for them. So that's the easy answer. Invest in that kind of infrastructure, and, you know, make sure that it's not really all kind of that the procurement process is reformed. Let's put it that way.
Any and maybe Gunita, maybe you have some suggestions or some advice that you give to individual reporters, but you know, when the time isn't available, you know, for that long-term investment, when you need data now and you're running into some technological hurdles, are there any kind of runarounds or other ways to get the information that we need? You know, Gunita, for example, if a reporter comes to you and says, I need to get this data, but it's, you know, this one website where it's all located is providing it to me in a very inconvenient and accessible way, you know, what would you suggest that reporter do, or any citizen do, to get that information they need in some other way?
That's a great question. It's tough because a lot of times journalists come to us and they're under the pressure of the deadline. And the one thing I always say is that delay is the most common theme inherent in the public records world. So there are a couple things I would say. I would say if you are filing a records request with a state or local office, a lot of times these smaller municipalities, sometimes they don't always have funding for good records management infrastructure. So I always say call them ahead of time. As soon as you get the idea for your public records request, give them a call ahead of time, establish that rapport with the records management staff, because sometimes these records are located in old filing cabinets. And if you give them a heads up, it's going to save them minutes or hours or days of searching. So when you actually do submit the public records request, you know, they'll have gotten that head start and you'll get your records more quickly. Other than that, the second biggest piece of advice I can give is it's always worth it to cover your basis. If you're working under your bases, rather, if you are working under the pressure of a deadline, file a federal FOIA request and a state records request and a local records request, triangulate, because I've had situations where I have asked for the same kinds of records from a federal agency and a state agency, and I've got the state records twice as fast. Sometimes you can only get records from federal agencies that have those bigger backlogs we hear about that last for years and years. And those can be helpful supplements to the records you get from state and local entities. But by all means, cover all your bases if that's something you're interested in doing.
Thank you. Good advice. I have another question here, unrelated. It's Amy, who wants to know what the Clery Act is all about. Amy, maybe you can fill us in on what the Clery Act is and whether it has a role at all in our pursuit of information when it comes to health data.
I have actually not ever had an experience with the Clery Act, so I'm going to punt it to Gunita.
All right, my apologies. Gunita or Amanda, do either of you have any experience working with the Clery Act, and give us some perspective there?
I have no idea what this is. I'm so embarrassed.
Me too.
All right, we will follow up. We'll make sure through Summit channels we'll get some information about the Clery Act, and make sure, Amy, you get all the answers you need. Any other questions?
Well, now I'm curious. Now I want to know from the panelists about the Clery Act and how people are using that to prevent sharing of data.
We'll certainly get more information and we'll pass it along. So don't fret, Amy. We'll make sure you get your answers, the answers that you're looking for, one way or the other. We do have a few more minutes left if anybody has any additional questions.
I'll just make another plug for the Reporters Committee hotline again, because sometimes if we're not able to answer your questions directly on this panel, feel free to get in touch through the hotline. Now, I'm also, like Amanda, very curious about what this is, so I promise I'll do my research and try to help that individual who asked that question.
Thanks. Actually, we have one. This will be our final question, but it's directed towards Amanda, and I think this is a great question, and I think it's going to be very helpful for many of those that are running their own FOI coalitions or press associations that that are looking for funding. The question from David Amanda is, how is the tracking project funded? How did it begin? And do you have any suggestions for those that might want to begin similar efforts in their areas?
You know, thank you so much. So we did start, we are more or less funded by several nonprofit foundations, some of which already had relationships with the Atlantic magazine. We talk occasionally about the idea of spreading the model around, and I think it's something we'd like to explore more. But I have to say it's quite unique in my experience, and I have worked a lot with things that have been funded by nonprofits and sort of online communities. So this was mostly a volunteer effort. Well-funded and well-staffed is actually kind of amusing to hear you say that, because we are so primarily a volunteer organization. There are, I don't know the exact number, but I think it's fewer than 24 people who are paid. And that's in the context of at least 150 people, 300 people who are doing volunteer work to collect this data with us. So it really began just with, and it actually speaks to the previous question as well, because, you know, talking about how can you work around outdated technology, I mean, that is really what we've been doing. I mean, so much of this data that states are providing is not downloadable at all. They provide it in a PDF. We have human eyes going and looking at it and typing it into Google Docs. And we have volunteers who are willing to do that because of their commitment and their service. So I think it's Alexis Madrigal at the Atlantic did a lot of work to make sure to figure out an organizational structure for it. We looked into becoming an official nonprofit, a 501c3, and honestly, there just kind of wasn't time. You know, it was the fog of the pandemic. We needed to get up and running and have some kind of organizational structure right away. So we are functionally part of the Atlantic, but any foundation funds, we're funded by the Beneficus Foundation and the Rockefeller Foundation and a couple of other people. Any funds that they give for the purpose of paying a few people who are helping to run the COVID tracking project goes into the Atlantic Magazine's foundation fund and is entirely separate from the Atlantic magazine itself, any of its editorial functions or any of that. So any of the foundation funds go sort of funneled through the Atlantic's foundation directly to the COVID tracking project. And we only have maybe usually 2 or 3 months of runway of funds. We're never quite sure how long we need to exist. So the foundation funding that we do have is going just to pay a very few people on a contract basis, not even on a full-time employee basis. So I hope that helps, but it's just sort of people coming together to do what needs to be done, you know?
No, I think that could be said for nearly all organizations represented here and in attendance. I would think that there would be a lot of foundational support and opportunities out there to pursue this kind of data, especially now. With that, I do want to thank all of you for joining this panel. Tremendously helpful, a lot of great information, and I would encourage everyone who views this session, who's here now, to follow up with any of us. If you're encountering any kinds of issues in New England in particular, please reach out to me at nefac.org. Please reach out to Gunita at the Reporters Committee. Amanda and Alameen, I'm sure, would make themselves accessible to follow-up conversations and to provide help in any way they can. So many thanks to all of you, our guests today, for taking the time to explain these issues to us and make sure we have a better understanding of our access to public health data moving forward. Thank you again.
Thanks.
Thank you.
Hey guys, thank you. I'll see you next time.
All right.
Thanks,
Thank you, Maggie. And
Bye.
thank
Take
you both.
care.
Take care.